All right, so here's a patient that was referred to me for this front tooth, and she was having an infection around the area. She finally became symptomatic. So this is, again, looking at it from profile. All this black area is just basically infected bone. You see a lot of bone destruction in this area. Now you have very little bone on this outer edge. And so I look at its case and I'm like, oh my, this is not good, especially for a front tooth implant. If we want to have any sort of predictability here, then we're going to have to remove this tooth, obviously. But the problem is that there's going to be a lot of destruction in this outer area. So I told her that she needed to do that guided bone regeneration. We had to do an extensive bone graft. So here we go. You could see the titanium mesh membrane. We did a guided bone regeneration on this patient, and you can see the little tacking screw in that area. So this is a 3D scan. You could see again the titanium mesh membrane with that little tacking screw, so you could see how much bone we had before, and now this is all new regenerated bone. And you could tell, right, the bone has a different consistency than the surrounding bone. Now let's look at the implant, and here's the implant 2 years later. This is back in November of 2022. The amount of bone that we have surrounding this dental implant, and exactly how big is this implant, the diameter implant. So about a 4.5 diameter implant that we use for this patient, so it's nice and stable. And we have plenty of what we call that buccal bone. Again, if you watch my videos earlier, this buccal bone is one of the predeterminers of success for a long, to make sure that this patient has a good long-term outcome prognosis, aesthetically, and also for the health of this implant. So the only way that I was able to achieve this is by doing bone augmentation procedures, and we never even did a gum graft for this patient. And so let's actually look at the photos of her. So these are photos that were taken before we placed the implant, but after the bone graft, and this is from a few years ago. This is what she looked like when she was smiling, when she was missing that tooth. And this is a tooth with a crown. So the patient was really satisfied with the aesthetics.